We continue our look at vascular health in this week's Medical Moment.
Fox 17's Tim Doty checks in with Spectrum Health Medical Group to learn more about blood flow and kidneys.
The renal artery is the main blood supply to the kidney, and issues with blood flow there can cause major problems.
They can develop narrowings, similar to any other artery in the body that can develop narrowings. They can also develop aneurysms, which is where the wall weakens and starts to balloon or get bigger. Thrombosis from somewhere else in the aorta or somewhere else in the body can embolize too. Thrombosis is where the blood vessel becomes very diseased and narrows, and then within that narrowing, sometimes clot can develop.
Dr. Eanas Yassa of Spectrum Health Medical Group says the most common symptom is no symptom at all, so you have to pay attention to your body.
The things that can sometimes prompt us to treatment or prompt someone to be diagnosed with renal artery disease is if they develop sudden hypertension in someone younger than 50, if they have hypertension that's resistant to medications, they're on many medications, usually 3 to 5 or more, and they can't get the blood pressure under control, or if they start to develop impairment in their renal function and no other source is able to be identified.
Because the symptoms are sometimes hard to find, a lot of patients have concerns about achieving a proper diagnosis.
Oftentimes, as simple as an ultrasound performed in our office can help us diagnose if there's a concerning renal artery stenosis or a renal artery aneurysm. And then from there, sometimes contrasted imaging that includes CT scans or MRIs or an angiogram.
Treatment matches that of other arterial problems and can include medication, balloon angioplasty, or something larger like open surgery. But that all depends on location and severity of the problem.
There are some people for whom we know that doing an operation isn't going to improve their renal function or isn't going to fix the problem, and those people we wouldn't typically offer an operation to. There are some people that we know, with this simple correction we can perhaps improve things, and that's something that with a discussion with your surgeon and your primary care doctor, they can help you figure out if you're the right candidate for this type of operation.
Tim Doty, Fox 17 News.
Well, it's windy here at home, but at least not doing